and you will know that I'm not going to necessarily say anything new for our introduction aside from saying who our presenter is. So just as a bit of housekeeping in our community agreements, of course, we want to make sure that we are being respectful of everyone, being patient with everyone, including ourselves, and asking questions. So with that, I want to make sure that you all are able to utilize both the chat feature as well as the Q&A feature for today's seminar. In addition to that, our presenter, Dr. Aparna Bull, may ask you some questions which may require that you utilize the chat feature just to keep us engaged on this Tuesday morning. So please be on the lookout for those questions. Now, before we get ourselves started, I wanted to allow you all to kind of test the chat tool and just say good morning to your fellow attendees. But please make sure that you are responding to all panelists and attendees in your responses by saying what your name is, tell us who you are, and what organization you represent, whether it is at CASE or whether you are outside of CASE. All right, thank you, Sweatland Center. Nice to see you all this morning. I see that we have students from CASE. Awesome, awesome. Our nutrition department, our engineering department is present this morning. We have public health students present this morning. Great. All right, so good morning, everyone, again. Okay. Just gonna transition over to my notes. All right. All righty. So today's presentation is by one of our Sweatland Center faculty affiliates. But not only that, Dr. Aparna Bull has so many titles and so much responsibility associated with her work both at UH Rainbow Babies and Children's Hospital, as well as being a faculty member in Case Western Reserve's School of Medicine. At UH, she is the medical director of community integration, and at CASE, she is an associate professor of pediatrics. She leads efforts to build close partnerships with community organizations as well as stakeholders to enhance the well-being of patients and families at UH's Rainbow Babies and Children's and MacDonald's Women's Hospitals. In addition to that, she supports innovation in women's and pediatric primary care delivery. Dr. Bull serves as the chair of the American Academy of Pediatrics Council on Environmental Health, as well as on the Board of Healthcare Without Harm. And in her role, she is a co-chair and is a founding advisory council member of the Ohio Clinicians for Climate Action. So today in her presentation of What's Good for the Planet is Good for Patient, Hot Topics in Pediatric Environmental Health, Dr. Bull will give us highlights of efforts to build those close relationships with those stakeholders and learning a bit more about pediatric care delivery, particularly at the intersection of environmental sustainability and pediatric public health. So now I am going to stop sharing my slides and turn the floor over to Dr. Aparna Bull. And you will see me make a couple of posts in the chat box, just encouraging you all to send in your questions either via chat or the Q&A feature of Zoom. And please let me know if you all have any questions. Okay, so Dr. Bull, I'm going to stop sharing my slides.
Thank you. I am going to work on sharing mine here. Are you all able to see my slides and hear me?
Yes, you're good to go.
Okay, perfect. Well, good morning, everybody. It's nice to be with you virtually. I really appreciate your making the time to be part of this conversation. Looking forward to chatting with you about pediatric environmental health topics. And what I'm going to try to do during the course of my presentation is ask some open-ended questions and invite you to respond in the chat box. So we'll see how that works. And I will get started. I have no disclosures this morning, and really what I'm going to talk about today is a little bit of a potpourri of pediatric environmental health topics that are sort of currently top of mind for me as a clinician and an advocate. So kind of a hodgepodge of topics, but all timely, and I hope feel relevant and engaging for you guys as well. So I'm going to start by talking about lead poisoning prevention, talk a little bit about safer chemicals, both clinically and as an advocacy topic, and then conclude by talking about climate change and clean air. So lead poisoning, as we all know, has thankfully received a lot of attention recently from policymakers and from a number of local stakeholders, which is very good news. I'm going to talk a little bit about sort of clinical aspects of lead exposure and then give you guys a quick update about what's happening locally and at the state level on lead poisoning prevention work. So I'm going to try that chat function first. If you could type in the chat box, what are some sources of lead exposure here in Ohio? Oops. I'm going to see if I can see the chat. Hold on. Here we go. Okay, so if you could type into the chat, what are some sources of lead exposure in children in Ohio? Okay, I'm seeing some messages come up. Paint in old homes, old pipes, so water, soil, old homes, paint, particulates in the air, dust from house debris. So I'm seeing a lot of paint dust and chips and soil and water. I see toys. So I'm glad that so many of the responses focused on paint and housing, because in Ohio, 80% of exposure to lead in children comes from lead-based paint dust and chips. So here is a representation of that. Some people mentioned water. So in places with lead service lines, especially if there's mechanical disruption to those lead service lines, or if there's issues with the way the water is treated, like we saw in Flint, water could be a source, not predominantly the case here in Cleveland. For us, really, it's housing. I wanted to mention a few maybe more unusual sources that people don't always think about. There are some hobbies and occupations that result in lead exposure. This is an indoor firing range. So sometimes we see if teenagers, or in my practice, it might be a teenager who does indoor firing ranges as a hobby, or riflery. People who work in indoor firing ranges. I mentioned crafts, so like stained glass and glass blowing can be a source of exposure. We also have some immigrant communities here in Cuyahoga County who have exposure from certain traditional cosmetics and also spices. So this right here, the red powder is sindoor, or vermilion powder, that's used in South Asian cultures in religious ceremonies. And that actually, we've had a handful of cases recently of children who have ingested lead-contaminated sindoor powder. Traditional cosmetics that are used in a lot of different cultures, they be with the eyeliner and these sort of decorations on her face. That's kohl or kajal. It has a lot of different names around the world, and is used in young children here, for example, in South Asian cultures, sort of for religious reasons. That product is often contaminated with lead. So we sometimes see kids who get their hands on it and ingest it, and that can be a source of exposure. Some spices, especially those purchased in open air markets abroad, like turmeric, have also been implicated in lead poisoning in our county. So here's sort of like the list with indicating that lead-based paint dust and chips in pre-1978 housing is really by far and away the biggest source. We also see there's some other occupations like construction, plumbers and pipe fitters, and a handful of other occupations where lead exposure in the workplace can be transported home on clothing. If parents aren't changing their clothes, then that can be another source of lead exposure in children. So the primary target of chronic lead exposure in children, when it comes to toxicity, as most of us know, is the developing brain. So lead exposure, chronic lead exposure has effects on cognition, learning, attention, behavior, and really has lifelong consequences. I didn't include a lot of the charts that I often share with my residents, but talking about risks for school failure, decreased lifelong productivity, interactions with the criminal justice system, really, and also that in addition to all of those things, we're also learning that, that lifelong consequences of lead exposure can result even in a higher burden of chronic diseases we don't maybe always think about with lead exposure, like cardiovascular disease in older adults. So when we think about the economics of lead exposure, depending on how wide we cast our nets in measuring the economics of lead exposure, the cost to society, if we think about the healthcare system, education, criminal justice, the cost of lost IQ and lifelong productivity, depending on how wide we cast our net, the costs are large. And so I think it's important to understand that first of all, the only treatment for lead exposure really is to not be exposed anymore, or to not to be exposed in the first place. Really, our target in lead poisoning care for children is to prevent exposure in the first place. We talk a lot about testing and secondary interventions, but what we want is to invest in primary prevention so that children aren't exposed in the first place. And if you look at the return on investment for primary prevention of lead poisoning, it's pretty staggering what that return looks like. Again, depending on how the time scale and how wide you cast your net in measuring that return. The only thing that even comes close in pediatric public health is the return on investment from childhood vaccines. And if you look over a life course and look at all these different sectors, lead poisoning preventing lead poisoning is just a great investment. So it's really about a lack of sort of political will and collective effort to accomplish this. So we now have sort of this multi-generational problem in Cleveland and other cities that is a source of health disparities and injustice. And I'll talk about that in just a second. So we talk about pre-1978 housing. Well, it's not all pre-1978 housing that confers equal risk. It's not just about housing age, but it's also about maintenance and investment. And I think, unfortunately, sometimes when people are talking about lead poisoning, or they think about housing and unsafe housing, there may be inadvertently sometimes be a tendency to sort of cast this problem onto the victim, like that, that, oh, it's an issue with housekeeping or house maintenance, or, so there's sometimes this, I think, this casting of blame. But really what lead poisoning comes from is from systems that have resulted in systematic disinvestment, especially in Cleveland and historically Black neighborhoods, and in minority neighborhoods in other countries across the city. So many of us have seen this redlining map of Cleveland that indicates in sort of the New Deal era which neighborhoods in Cleveland were deemed high risk for housing investment and for mortgages. So the red indicates high risk. And if I were to overlay a current map of where the highest prevalence of lead poisoning still occurs in children in Cleveland, it would match up pretty well with this redlining map. So this is during this era, from when this map comes, the Federal Housing Administration didn't just have rules about lending in quote unquote high risk neighborhoods, which essentially were Black neighborhoods, but also some language about policing practices to enforce housing segregation. I mean, it's really very clear that that codified in policy were systematic mechanisms to ensure disinvestment and discriminatory practices in historically Black neighborhoods. And the legacy of those practices continue today. Redlining continues today. Systematic disinvestment in minority neighborhoods continues today. So when we talk about age of housing stock and maintenance, the neighborhoods that are at highest risk for disinvestment, crumbling housing infrastructure and other infrastructure are on the east side of Cleveland, historically Black neighborhoods. And there's actually so much more data coming out now about additional sort of health disparities that persist in red line neighborhoods. So there's a recent article about extreme heat effects being greater in red line neighborhoods, birth outcomes being worse in red line neighborhoods. So the effects of this systemic racism when it comes to housing policy, we're continuing to pay the price, and the children who live in these neighborhoods are continuing to pay the price. There are neighborhoods in Cleveland whose prevalence of childhood lead poisoning is 2 to 4 times the prevalence of lead poisoning at the peak of the Flint water crisis in Flint. And that has been a persistent problem, despite what I just said about the incredible return on investment and the fact that we know exactly what to do to abate lead poisoning, which is to provide safe housing for children. I also think it's important to point out what an elevated blood load level means, because people talk a lot about testing and quote unquote treatment. If someone know like how is the reference level for an elevated blood load level determined? If you can type it in the chat box. A blood test, so it's determined, it is a blood load level. Right now, the reference level for elevated blood load level is 5 in children. It used to be called a level of concern by the CDC, which the CDC no longer calls it that because, yes, it's based on national trends, right? So the level is 5. I'm seeing some answers. The current reference level is 5 micrograms per deciliter. It's determined by national trends, and it's a blood load level. So all of those things are correct. And it used to be called a level of concern, but that was renamed several years ago to a reference value because there's no level of lead in children that is safe. The only safe level is 0. When I was a resident, the reference value was 10 micrograms per deciliter. Not too long before that, it was 20. And really that is a public health level that is chosen based on NHANES data every 2 years. So it's population level data on lead levels in children. The level of 5 is a level at which 97.5% of children under the age of 6 have a blood lead level lower than that. So that is how the number is chosen. I think it's really important to understand that because all of the information that we know about the impacts of lead on pediatric health and over the course of a lifetime is based on population data. So it's not as if I could say that a blood load level of 6 micrograms per deciliter results in like 2 lost IQ points or something like that. And I think it's a common source of confusion, both with the public and with parents. They want prognostic information based on a child's blood load level, and that we really can't provide that. It's also not diagnostic. So sometimes I have parents who have, a 2nd or 3rd grader who have ADHD, and they want me to check their blood load level to see if that's the reason they have ADHD. And that's also not useful. So it is a risk factor for school performance issues and behavior and learning issues. In general, the higher the blood load level and the longer that the blood load level remains elevated, the likelier it is that a particular child will have toxicity that is appreciable from that exposure. But it's really, in general too, lead exposure is just one risk factor for school performance. So the child that has other risk factors stacked on top of that is also more likely to have consequences. A child that has, protective factors like high quality early childhood education, a stimulating environment to promote healthy development, optimal nutrition, and other protective factors, that child is less likely to have long-term consequences. So when we talk about treatment, we now can refer children to early intervention in Ohio. Anyone with an elevated blood load level is eligible for early intervention. Helping parents to get connected with high quality early childhood education, providing information about promoting early literacy and healthy development, information and resources to optimize nutrition. Those are some of the things that when we talk about treatment, that's really what we're doing to help counsel families who have kids with elevated blood load levels. And again, the most important treatment is to prevent ongoing exposure. So I think sometimes in the conversation about lead exposure and treatment, there's a bit of an overemphasis on this testing and treatment. Testing is important. We do still have some kids, thankfully it's more and more uncommon, who need medical chelation therapy, where they actually have to come into the hospital if they have blood levels over 45. But really, for most kids, the treatment for elevated blood lead levels is to prevent future exposure and to ensure a nurturing environment that supports healthy development. So really, it's safe housing. The treatment is safe housing and healthy developmental supports, which really we should be prescribing to every child. So just to point out, like right now, unfortunately, our primary prevention efforts historically have not been sufficient. And so we are essentially using children as lead detectors to decide how to prioritize our housing abatement. And so some of what we're trying to do locally and at the state level, thankfully with a lot more sort of support from stakeholders and policymakers, is to change that paradigm and focus on primary prevention. I see a question about a barrier of cost to these treatments. Early intervention does not come with a cost. The medical chelation therapy is covered by insurance. That's for the kids with very high blood lead levels. So if we're thinking about cost, a barrier for some families and landlords is the cost of lead safety measures. And so there's complete lead abatement is one avenue, and another is so just to completely remove sources of lead from the child's home environment is one sort of more costly avenue, and then to sort of have temporizing abatement measures where if there's peeling or chipping paint, the house is repainted, those kinds of things, replacing windows and doors potentially. Sometimes those are cost prohibitive for families, and there are sources through the CHIP program, and now through the Lead Safe Cleveland Coalition, we're making some efforts to create financial supports for low-income landlords or families who need assistance with implementing lead safety measures. So just really quickly, the Lead Safe Cleveland Coalition is a public-private partnership that includes local philanthropic organizations, city officials, healthcare, early education, early childhood education, and others. There has been, as some of you know, some progress on passing local legislation on lead safe rental registry program. The Lead Safe Cleveland Coalition is also working on setting up a resource center for families to assist with all things related to lead poisoning prevention and treatment. That Environmental Health Watch will be sort of the home for that. And then also part of that includes generating a fund for, as I mentioned, low-income landlords and families to have access to in order to pay for some of the lead safety measures. And then the state of Ohio, Governor DeWine has convened a lead poisoning prevention advisory council that includes clinicians, but also people from housing, contractors, landlords, and others, state agencies to provide some recommendations to the state on lead poisoning prevention. There had been sort of a long hiatus during the COVID pandemic. We actually are reconvening after a several months break this afternoon. And it's been really revealing to work with landlords and contractors on issues related to like workforce development around people who do lead inspection and abatement and those kinds of things. So I'm hoping that that results in some additional investment from the state along those lines. And then also the Ohio chapter of the American Academy of Pediatrics. We have a statewide quality improvement program that is in partnership with the Ohio Department of Health to work with practices on improving adherence to primary prevention, counseling, anticipatory guidance, but also to screening and testing guidelines for all of our high-risk kids who need to be tested at 12 and 24 months at their routine primary care visits. We have like 6 practices around the state involved in that, and I'm the medical director of that program. So we just kicked that off. Okay, so I'm gonna leave Oh, actually, I have one more thing to say about lead poisoning, which is the American Academy of Pediatrics and others have been engaged around advocating for amendments to the lead and copper rule, the EPA's lead and copper rule, that will provide more robust protections for safe drinking water. It's been an uphill battle, but we're still sort of engaged in some pretty fierce advocacy to strengthen the lead and copper rule. Okay, so I'm going to talk a little bit about some clinical environmental health topics that are just timely right now. I'm not going to have time to go through sort of everything that I would normally talk about with clinicians around elements of the environmental health history and anticipatory guidance related to environmental health, but I'm going to talk about a few of them. Oops, that was weird animation. Sorry about that. Hold on, let me get this slide up. Okay, so there's a lot that we could talk about when it comes to clinical environmental health history taking and anticipatory guidance for pediatric patients. I'm not going to talk about all of those things, but I want to touch on a few that are just kind of timely right now, which includes cleaning and disinfection practices. Just say a quick word about environmental justice issues related to personal care products and cosmetics. And then we have some timely advocacy going on right now related to food contact substances and food additives. So I'll mention that too. So I want to just mention cleaning and disinfection. I feel like it's timely in this time of COVID because people are very concerned about disinfection right now. And so we're seeing some interesting things in how that's kind of playing out in people's homes, childcare centers, and elsewhere. We know that cleaning and disinfection chemicals have an impact on indoor air quality. So this is something I talk about anyway with parents in primary care. We know that in workplaces, for example, environmental services workers and nurses have among the highest rates of occupational asthma among the professions. So it's relevant to us in healthcare and in other settings too. Cleaning products can trigger asthma symptoms, we know this. So when I talk to parents about cleaning and disinfection in this time of COVID, we talk about the difference between cleaning and disinfection. That disinfection is recommended on high-touch surfaces. You do not have to disinfect everything with a chemical disinfectant. People, I think, are erring on the side of overuse of chemical disinfection because of fear of COVID. The other thing I tell people about COVID is that coronaviruses are very easy to kill. There's no reason to reach for a hand grenade when a fly swatter will do, one of my colleagues said, and I think that's very true. I talk to families about cost-effective and safe homemade cleaning products. That I talk to them about using white vinegar for most applications. I talk to them about making their own wood safe cleaners too. A lot of families really appreciate this, both because it's safer and because it's less expensive. And then we talk about disinfection, that alcohol and hydrogen peroxide are some of the options that I lead with, and that if they're going to use bleach, to make sure they're using an appropriate dilution. And I really discourage the overuse of like Lysol wipes and Clorox wipes. I see it in my practice that some of our staff want to sort of overuse these disinfectant wipes. And I see it in households and even in childcare centers. And worse yet is that sometimes children who are being asked to sort of help clean up are wielding some of these chemical disinfectants, which is definitely not recommended. So I talk to families about that too. The Green Seal and Eco logo are just here to remind me that those are third-party certification systems for household cleaners that families can look for if they are buying commercial cleaning products. And then Environmental Working Group, it's not a perfect resource, but it does have a really good, it has several really good parent-friendly, consumer-friendly databases that help cover specific types of products, including cleaning products, but also cosmetics, sunscreens, and others. So it's a good resource for families. And here's another good resource. As many of you know, the Pediatric Environmental Health Specialty Units, or PACU network, is a really wonderful resource both for clinicians and for parents and others. Every EPA region has a PACU. Ours is headquartered in Chicago, but we have a satellite in Cincinnati. It's really helpful for clinicians to know about. It's a source of sort of toxicological advice when we have clinical cases where we need help, but they also have really good webinars, fact sheets, and other resources related to environmental health for children and for pregnant women. This is from the Western States PACU. It's a fact sheet that I actually have been giving to patients that explains the difference between cleaning and disinfection. There's also a link on the fact sheet to sort of less toxic chemical disinfection choices. So this is on the PACU website, and I've been handing it out. I want to mention a little bit about personal care products. It's so weird how my animations are. Sorry about that. What I usually talk to families about with personal care products, just in general, is number one, to avoid synthetic fragrances when possible. It's helpful both because that can be irritating to kids with allergies or asthma. Phthalate exposure is also a concern. As some of you know, phthalates are plasticizer, and low molecular weight phthalates are used in fragrances and cosmetics for like a color fixative. Phthalates are endocrine disruptors. They are also ubiquitous in the environment, so it's pretty tough to avoid them altogether, but a good way to reduce phthalate exposure through cosmetics and personal care products is to avoid fragrances, synthetic fragrances. I often talk to families about preferring regular soap over antibacterial soap. The FDA says there's no evidence that antibacterial soap confers additional infection protection over good hand washing with regular soap. And some antibacterial agents are endocrine disruptors and can also contribute to increasing clinically significant antibiotic resistance at a population level in pathogens. Hair products, definitely something that needs to be discussed in a very culturally aware and humble sort of a way, but chemical hair straighteners are not an infrequent source of poisoning calls, because chemical hair straighteners and home permanent products can be corrosive to the skin, respiratory tract, and GI tract. I remind families that all cosmetics, personal care products, and hair products should be stored out of the reach of children. And things like hair dyes and hair straighteners should, if possible, not be used around children or on children. I have a couple other things on here I wanted to mention. So first of all, with nail products, this is something that also comes up not infrequently. What I tell my patients is that children with hand-to-mouth behavior shouldn't use nail polish at all. In children, water-based products might be safer. I have a number of teenage patients and parents who work in nail salons. We know that acrylic nail powder is quite toxic, and there are also some solvents used in nail salons, some of which continue to contain toluene, which is toxic. So I ask patients and parents who work in nail salons or who go to nail salons about ventilation and personal protective equipment. I brought up, so let me just pause and say that there are a number of different agencies and statutes that govern the regulation of consumer products, cosmetics, and food additives. It's complicated, and some of these rules are outdated. So I'm going to talk in just a minute about some of the advocacy that we're doing to try to improve chemical safety from a policy and regulatory perspective. And I also put that on there to remind myself to say that when I'm talking to families about things like cleaning products or personal care products or what have you, I think it's important to tell parents that it's not reasonable to expect that we should be able to purchase our way out of this really broken chemical regulation system that we have in the United States. It can feel a bit like an obstacle course, whether it's food purchasing or personal care products or whatever. Like, if I choose this product, I'm exposed to X, Y, and Z. If I choose that product, I'm exposed to something else. And it's confusing and stressful for some parents. I think there's some simple advice. This is like very simple: avoiding synthetic fragrances, the advice about home cleaning. I think like distilling it down to a few simple pieces of clinical advice, trying not to stress parents out, but providing them with enough information to feel empowered in purchasing choices. But ultimately, we need to make changes in how chemical safety is regulated and enforced in this country. So that I wanted to make sure I said that. And the other thing I wanted to mention was just sort of the environmental justice implications of chemical exposure from some personal care products. One dimension of that is, as some of you may remember, there was a lot of media around some studies that showed that nail salon workers had higher rates of premature birth and low birth weight. And we know that, who works in nail salons? A lot of recent immigrants, a lot of women of color. So one sort of dimension of environmental justice. And I also wanted to share that there's more information on that topic from the American College of Obstetricians and Gynecologists. They have a sort of a position paper on exposure to chemicals, and they really focus on personal care products and cosmetics. And they mention sort of the environmental justice component, not only from the standpoint of workers, but this is another piece that was published in by ACOG, this one by Dr. Zoda about the environmental justice of beauty. One thing we know is that that Black women and Hispanic women have higher urinary concentration of phthalates and other common industrial chemicals. There are probably a lot of reasons for that, but this piece is talking about cosmetics and how they're marketed, and also the sort of inequitable exposures because of who tends to work in beauty salons and nail salons. And one of the things that I found pretty fascinating in this piece is talking about how cosmetics are marketed. So you think about chemical hair straighteners or skin lightening creams, that there's this sort of racist beauty ideal that's been perpetuated in the way some of these products are marketed to women of color. I just think it's a really interesting it's an interesting point of view, and there's a lot more in this piece that I don't really have time to go into, but just sort of an interesting and I think important dimension of thinking about environmental injustice and women's health. Like I said, it's a little bit of a potpourri of topics today, so I'm going to jump for just a moment to food additives, because this is another timely advocacy topic. It is something I talk to families about. This is a policy paper from the AAP that was published last year that got a fair amount of media, and it talks about exposure to food additives and contact substances. It includes some recommendations for parents that I've incorporated into my anticipatory guidance about, for example, avoiding microwaving in plastic, trying to avoid running plastic storage containers through the dishwasher. This is preferring fresh or frozen produce. The chemical exposures that are a focus in those recommendations are bisphenols, which are found in the lining of canned foods, and phthalates and plasticizers, which can leach when plastic is heated. So got a fair amount of attention. Parents are concerned about this, so I do talk about it with parents. It also contains quite a bit of recommendations and guidance for updating regulations of safety around food additive and food contact substances. So that one is very timely. I wanted to bring it up. This is a screenshot from the Environmental Defense Fund that talks about some of the issues around FDA regulation of food contact substances and food additives. Some of the issues that are of concern relate to chemicals that are generally recognized as safe, which are not subject to ongoing evaluation, but may have been deemed generally recognized as safe before we have sort of more updated evidence about some of those materials. So that's one issue. And there's also a concern about insufficient consideration of cumulative exposure to food contact substances and additives, as well as interactions between food additives and food contact substances. So this is the subject of a petition that the EDF filed this week directed at the FDA, and the AAP signed on. And actually I'm getting some media requests today, so it seems like this will be sort of in the news too, but so there's some pretty active advocacy to try to encourage the FDA to update these practices. A couple other really quick safer chemicals topics. As some of you all know, the EPA during the last administration determined that chlorpyrifos, which is a toxic pesticide, it's especially concerning for farm workers and their children. They decided to ban it, and then that decision was reversed during this administration. The EPA has also decided not to regulate perchlorate, which is a thyrotoxic chemical found in drinking water. These are issues that the AAP is pretty active right now in sort of fighting. there was an update of the Toxic Substances Control Act that the AAP was active in encouraging the TSCA to be reformed, and it was updated in 2016. Sort of a complex issue in itself. There's a lot to this update, but there are many things in this Lautenberg Act, which was an update of the Toxic Substances Control Act, that strengthened our ability to review industrial chemicals. And unfortunately, that the Lautenberg Act has not been enforced by the current administration. So we haven't seen a lot of changes, and this is another area of active advocacy for the AAP and others. I should say that in general, like the EPA regulations and child health protections that we've been talking about are not by definition partisan. As we all know, Richard Nixon signed the EPA into existence in 1970. It was George H.W. Bush who really implemented some key components of strengthening the Clean Air Act. But in the current administration, we have some issues with who has been put in charge of enforcement in EPA. So this is Nancy Beck. It's actually Dr. Beck. She was a lifelong lobbyist with the American Chemistry Council. She was running the toxic program. She's been running the toxics program at EPA, has sort of been a lifelong opponent of consumer protections and EPA chemicals regulations. So she has not been keen to enforce, for example, the Lautenberg Act, and has been sort of behind a lot of the weakening in chemicals regulation at EPA. She also was nominated to this year to run the Consumer Product Safety Commission, CPSC, and actually ran into some bipartisan opposition. As far as I know, her nomination is sort of frozen. It hasn't moved forward because there were policymakers on both sides of the aisle that were concerned about her ability to run CPSC. So I'm going to switch gears just for a couple minutes here, and I'm checking the time to talk a little bit about climate change and clean air. So what are, you guys can type this in the chat box. What are some health impacts of climate change that are already affecting people in Northeast Ohio? What comes to mind for you? While you guys are typing your answers, I'm just gonna say, advance here. I think that I think that climate advocacy has been hamstrung a little bit by sort of the early Greenpeace well-intentioned campaign of kind of making us think about polar bears and, the Arctic Circle. I think still too often people think about climate change as something that affects another species in another time and place, instead of something that affects children, people, here and now. And so what I would like is for us as health messengers to help flip that script. We're not really talking about this upper left picture. That's not what people should be thinking about when they think about climate change. They should be thinking about some of these other pictures that are more immediate in our backyard and affect human health. So I'm seeing a lot of answers come in: flooding, heat island impacts, elevated temperature, asthma, storms, heat, flooding, respiratory disease, warmer winters in Ohio, asthma. So all really good answers. When I think about climate change in Northeast Ohio, the effects that I usually cite first are impacts on air quality, extreme heat, extreme precipitation events, and changing patterns of infectious disease. All of the others on this list are also current health impacts of climate change. I think the first four are probably the ones that are most immediate here. So just to be clear, when we talk about air quality and climate change, there are both direct impacts of fossil fuel combustion on air quality, as well as impacts of climate change on air quality. So just to be clear, when there are increasing surface temperatures, surface ozone concentrations go up. And as we know, ozone is good in the atmosphere, not good on the surface. ozone both causes and exacerbates chronic lung conditions like asthma and also impacts birth outcomes. With the shorter and warmer winters, we have longer aeroallergen seasons, and higher CO2 concentrations result in a higher concentration of aeroallergens too. So it's longer and more intense allergy seasons for our kids with asthma, higher surface ozone, and increased intensity of aeroallergen seasons is sort of a double whammy. Extreme heat. A lot of people don't realize that extreme heat is actually the leading cause of weather-related death in the United States. Some of us remember that during the 90s, there was an extreme heat wave in Chicago that really overwhelmed first responders, caused a tremendous number of deaths, especially in some of the most vulnerable seniors, people without access to air conditioning. If current pollution trends continue, that type of heat wave will be an annual event in Cleveland. So that's a problem. I see it in peds with my student athletes and infants. Extreme heat also impacts premature labor and premature birth. And then it also impacts seniors and others with chronic illness. Extreme rainfall, a couple people mentioned that the warmer atmosphere can hold more moisture. So when it does rain, it rains more extremely. And we are already seeing more frequent heavy rain events in the Midwest, which can cause property damage, stormwater and sewage mixing and runoff into Lake Erie, which affects the quality of our water and our ability to recreate in the Great Lakes. And in the northwest of the state, contributes to agricultural runoff that contributes to the harmful algal blooms that are affecting drinking water in Northwest Ohio. This isn't so much a local impact, but I just want to mention it, that I think it's sort of an underappreciated issue, that the nutrient quality of food changes in the setting of climate change. We know that, for example, the iron content of rice goes down with higher atmospheric CO2. That's a big deal. For a lot of the world, rice is a staple food. So just not only does it affect food security, it also affects nutrient density of major food crops. This is just a picture of something that has brought home some of these events to me recently. This is my hometown. I grew up in Portland, Oregon. This is what my city looked like until it rained I guess it was late last week with the wildfires in the Northwest and the West Coast. And this is a part of the country that was on fire, the foothills of the Cascade Mountains, that has always been damp and mossy and wet. And I just could not conceive that it was on fire. So it's pretty sobering to hear from my friends and family in Oregon. The AAP has a climate change and children's health policy statement. This is some of the strongest language that we use from the Academy. It's normally a pretty reserved and conservative organization in our choice of words. But in this policy statement, we say that failure to take prompt, substantive climate action would be an act of injustice to all children. It's about the strongest language we use. And we're in the process of updating that policy statement now. Some really good summaries of climate change impacts on children's health and recommendations for pediatricians and the government. Just really quickly on the direct effects of fossil fuel combustion on air quality. So for example, contribution of particulate matter pollution and other pollutants. We often think about that outdoor air pollution as an issue for people with asthma. That's true, but I think it's important for us to understand too that particulate matter exposure is also a determinant of birth outcomes, preterm birth and low birth weight. There was actually an interesting study from California when 8 coal-fired and oil-fired power plants closed. The rate of premature birth of women living proximate to those power plants went down by 20%. Some of my OBGYN colleagues say, you know, if we had a technology that reduced premature birth by 20%, we would be shouting it from the rooftops, insurance would be paying for it, we'd be having all these conferences about it, and clean energy is that technology. So I think it's important when we talk about infant mortality, there are a lot of determinants, but environmental determinants are really important. Air quality is really important. And in this country, race is the best predictor of one's proximity to environmental health hazards, and air quality is no exception. So environmental justice needs to be part of the equation when it comes to birth outcomes and infant mortality reduction. Air pollution also is a neurotoxicant. Even prenatal exposure to air pollution can result in disruptions in children's sleep, learning, attention, behavior, and cognition. I think this is a very sobering but accurate headline. Air pollution might be the new lead. We're learning a lot about the neurotoxicity, neurodevelopmental toxicity of air pollution. So when we talk about, School readiness is another pediatric environmental or pediatric health sort of hot topic. Infant mortality is one, school readiness is another. We shouldn't be talking about either one of those without talking about clean air and environmental justice. We're doing a lot of work on policy advocacy, the AAP, on climate change and clean air. This is sort of a list. We're working on, we are opposed to the rollback of the Clean Power Plan, the mercury air toxic standards. We are speaking up for strengthening the National Ambient Air Quality Standard, which governs ozone concentrations. We are opposed to the rollback of the methane rule. We're actively fighting on a lot of different fronts. Actually part of a lawsuit with the American Lung Association on the mercury toxic standards, and using a lot of different tactics to try to oppose these rollbacks of clean air protection. A bright spot is that we were part of informing the the House of Representatives Select Committee on Climate Change, their report, kind of a policy roadmap for climate action. We're hoping that we'll be able to act on that in 2021. In Ohio, a hot topic, as some of you guys know, is House Bill 6, which was a taxpayer-funded bailout of not only First Energy's nuclear power plants, but also coal plants, and also resulted in a rollback of Ohio's energy efficiency and renewable energy standards. And this is Andrew Wheeler. So when I talked about what's happening with this current administration, he is a lifelong coal lobbyist. And so these clean air protections are really handouts to the fossil fuel industry at the expense of public health. There's no other way to frame it. And then, as some of you have seen, we've made national news around the racketeering charges associated with House Bill 6, that there's allegations of bribery by First Energy of policymakers. And that's in addition to the huge campaign contributions they already make, and really do have an outsized influence in policy. And one thing I just want to mention is that there's been some studies on where in the country do we get the greatest return on investment from clean energy, both in terms of economics and health outcomes. There's no part of the country that stands to benefit more than the upper Midwest and Great Lakes. So Ohio's health is counting on accelerating our clean energy transition, not moving in the wrong direction by rolling back energy efficiency and bailing out coal-fired power plants. So we're actively engaged in advocating for repeal of House Bill 6. The AAP has a Vote Kids toolkit to inform the public and clinicians about child health related issues in the election. There are like 4 or 5 top child health issues that they include in their toolkit. Climate change and clean air is one of them. It's worth checking out. We have, I wanted to leave you on a hopeful note, so I want to say a few hopeful things about some great advocacy that's going on. We have a pediatrician climate advocate identified in every one of our 56 local AAP chapters, which is awesome. That means in every state and territory in the United States, we have a climate advocate. Here's one of our sisters in California. California Chapter 1 in Northern California has a whole committee dedicated to climate change and health, doing a lot of advocacy and education. There are a growing number of clinician climate action advocacy networks in states across the country. Here's our group from Ohio, the Ohio Clinicians for Climate Action, in one of our pre-COVID State House advocacy days. And there are a number of those cropping up multidisciplinary clinician climate and health advocacy groups across the country. We know that's really important because especially primary care physicians, but also other physicians and nurses are really trusted messengers on climate change and health, and can help to depoliticize what's become an unfortunately very partisan topic across all segments of the population, whether climate deniers or people who are alarmed by climate change. So clinician climate action is really important. I and one of my colleagues wrote an op-ed, have been writing op-eds on House Bill 6 and other related clean energy topics. Healthcare Without Harm is a national organization focused on sustainability in the healthcare sector. I'm the chair of their board, and we have a physician network that's very active in advocating for sustainability within the climate healthcare sector and climate leadership within the healthcare sector. That's because the healthcare sector is a huge contributor to climate change and contributes to climate resilience. If the US healthcare sector alone was a country, it would be a top 10 greenhouse gas emitter in the entire world. So we have a huge opportunity and obligation to act on climate within the healthcare sector. We contribute to climate change in a lot of different ways, the way we operate our buildings, our transportation footprint, and our purchasing footprint, which means we have a lot of different ways to mitigate climate change by the way we operate. And that's what this graphic is supposed to show. So when I talk to clinicians, I talk about climate actions they can take at the bedside. I know I'm running low on time, so I'm gonna just sort of speed through the slide or two here. There are clinical counseling tips that we can provide to clinicians to help them educate their patients about acting on climate in a way that actually promotes health. One of the most hopeful things about climate action to me is that climate solutions are child health solutions. So solutions that help us transition to clean energy, clean up our air, provide more sustainable, vibrant urban planning practices, access to multimodal transportation, provide more opportunities for activity, building social cohesion, and build more sustainable and safe food systems. Great for child health, great for the planet. So we also as clinicians can set an example by the choices we make. And then, as I mentioned, a lot of opportunities and avenues to speak up as a trusted advocate. In my own institution, I've been doing a lot of work on trying to promote sustainable practices. This is our new Rainbow Center for Women and Children, which is our home for academic pediatric primary care and outpatient OBGYN. Here it's at East 59th and Euclid. It's the only LEED Platinum certified building in Ohio, healthcare building in Ohio. So I love that the greenest healthcare building in the state is located in a neighborhood that historically has been on the receiving end of environmental injustice. The picture at the top is reminding me that I got my start as a resident in sorting, I sorted trash for a senior research project to demonstrate how much we were throwing away that we shouldn't be. And that was kind of the start of getting engaged in sustainable operations at UH and then at Healthcare Without Harm. Finally, the top two pictures, I think you guys know the one on the right is a picture of the Cuyahoga River on fire that was taken in 1952, run on the cover of Time magazine in 1969. And this picture on the top left is from the Lorax. It's the scene where the humming fish are fleeing the dirty water. And when Dr. Seuss first wrote this, he was inspired by how dirty Lake Erie was. And the original line was, the humming fish were searching for water that wasn't so smeary. They heard things were just as bad up in Lake Erie. And then he changed the words when Lake Erie was cleaned up. I mention that because while this is sometimes regarded as sort of a dark mark in the history of our region, it was also sort of we were the canary in the coal mine that woke up the entire country to give birth to the modern environmental movement. And here we have Lake Erie today and Cuyahoga Valley National Park today, some great success stories of the environmental movement. And similarly, you know, Cleveland and Northern Ohio, we weren't the only places that were experiencing rivers on fire and dirty water. We just had the dubious distinction of being recognized for it. Similarly, we're not the only place. This article from several years ago is highlighting the discrepancy in life expectancy between Huff and Lyndhurst here in Greater Cleveland. That was spotlighted in an HBO special in like 2014. Certainly not the only place where zip code is a better predictor of people's health outcomes than their genetic code, but we have the dubious distinction of being sort of the poster child for it. And I guess my hopeful comment is I think similarly, we are a canary in a coal mine around health equity too. So, and to me, these issues are very linked. So just like we woke up the country to the modern environmental movement, I think we have a huge opportunity to tie our efforts around health equity to environmental justice here in Ohio. And so that's something that really keeps me hopeful. And this is just some of the resources that I referenced in my talk. And I know I meant to leave some more time at the end, so I understand if people have to ring off, but I'm also very happy to answer questions.
All right. Thank you so much, Dr. Bull. You honestly gave a lot of us, there's much diversity in who was attending today and kind of where our backgrounds are and kind of where our careers are going to take us or where our research is going to take us. So I think that you covered so much in that it gives many of us a lot to think about with our professional lives, but then also personally as the as the election is coming up, there's a lot to think about, and what are the type of policies that have been put into place or that have kind of been diminished with the current administration, and looking forward to seeing how things can change. So I definitely appreciate kind of the high notes that you were able to leave us on, and as Darcy has said in the chat to us that she hadn't heard about kind of that Lake Erie line with the Lorax prior to today. I definitely can say the same, as probably many of us can say the same who are attending. But I did really quickly, before getting to a couple of questions that we had, I wanted to know if you would be able to send me your slide deck, and that I'd be able to post it along with the recording from today.
Yes, I'm very happy to do that. And I'm also seeing a couple questions in the chat. I think the ones from Darcy just went to the panelists,
Yes.
asking about citizen science and measures to make the medical case for more attention to environmental health issues. I think the challenge around the medical case, to briefly answer that question, is that often the link is not made. And there's a lot to unpack there that I don't have time to do, and I'm happy to talk about it. But I think a lot of the challenges that the link is not made, we're really lucky to have Dr. Malloy and others here at CASE who really are committed to incorporating environmental health education into medical school. That is a growing trend. I'm happy to see that. And I think some of it is about motivation, like what are the screening tools that we're reimbursed for, in clinical practice, and there's not enough environmental health history taking that's required of us. So right now, actually, there's a comment period for the Bright Futures Guide, which is what we use for pediatric primary care screening timeline. And so some of us are doing some advocacy to try to sort of beef up the environmental health aspects of anticipatory guidance recommended by Bright Futures. And then another question from Darcy was about citizen science and environmental triggers. I think we've talked about citizen science and air pollution. So I think that's one that has been used in other cities like Chicago really effectively to make some real changes in things like transportation planning and sort of other environmental policy issues in that city. So I think that's one example. So.
Thank you. I think there was comments from Tim and a couple of resources that he wanted to know about if we could learn from. And I believe Tim sent this to all panelists as well.
Okay, and maybe we could forward some of the links when sharing my slides, because it looks like he's got some good links here in his question. He says, given the failure of our federal system to protect us, are there local or international models of protection that you think we should learn from? Yeah, I mean, I actually have a lot of hope in what's happening at the state and local level. A lot of mayors actually are taking bold climate action collectively, with or without the federal government's support. One state that I am inspired by right now is Virginia. Virginia has a really and it's a politically pretty purple state. It has a very robust clinician climate action network. They've been really successful in advocating for clean energy policies at the state level. So I think that we can learn from other states, from cities, and it looks like you have some international examples as well. But I also have hope that, like I said, historically, this has not been a purely partisan issue. I think we're in a very unusual time right now, where we have a fox guarding the henhouse situation happening at the EPA, but it needn't be that way. So I think I'm heartened by the bipartisan climate action work that we're seeing outside the administration, and so I'm hopeful that we'll be able to turn the page soon.
All right, I just copied those links that Tim had provided us so that I can upload those along with your slides and your recording from today. I just want to see if we received any other questions or comments. All right. I think that's all that we had. Oops, oops, oops. For today. Tim, just because we are a bit over time, I am going to make sure that I copy and email this question to Dr. Bull and copy you on that email just so that this can be followed up at a later time. I just want to be kind of respectful of a little bit of time that we did go over. And I know that we do have some people who had to jump off the call, but that's no problem. I wanted to, again, thank Dr. Parnable for this amazing presentation that you gave us today. I feel as some of us who are parents, some of us who are really conscious of our own health, just thinking about what are the changes that we might be able to make every day, simple changes that are not as scary as some of our media outlets are making things seem for us, but also changes that we can make to ensure that the world is a better place, a safer place for our future generations. So again, I appreciate the time that you took with us today and the lessons and kind of action items that you left us with going forward.
Thank you so much for having me. I really appreciate it. And I'm sorry that I packed too much in and caused us to go over time a little bit. So thanks for hanging in there, and I'll be happy to answer additional questions via email.
Okay, no, it's no problem. What you started out your presentation saying that the conversation was timely, and it absolutely was. We originally had you scheduled for April, but I think that a September presentation was much better, just given that all that we have learned over the past, oh gosh, 6 months now, with working from home and
You cut out there for a minute, Jennifer. I'm going to thank everybody again and say goodbye. Hope you have a good day and be well. Look forward to staying in touch via email with anyone who still has questions. Thank you.